have to change the business model, and we have to get out of our comfort zone to go do this.
I attend, especially this event, I really don't attend many others at all because my peers are here. A lot of the healthcare organizations that are of similar size that we are here, I find the questions they ask are informative.
We've met companies here, healthcare facilities here, hospitals here, that we've partnered with now. This is our 4th year in attendance, and this is one of the key forums that we go to. It's always on our calendar, and it was outstanding as expected.
Disruptive is something in which it fails to exist the way that it does any longer and then changes dramatically into something completely different than we haven't seen before.
I think that the forum really allows me to interact with a variety of people who come from different sectors, and beyond that, it's really important for me to come to events. I do very few events where I get great content, but there's also good planning in the events, and things are changed up from year to year, so it's not a duplication and it keeps it fresh.
The output for this event for me allowed me to better understand what other institutions are doing across the country through many of the seminars that were presented, as well as new offerings from the vendors and the suppliers and how they can better help me maximize my business efficiencies, lower my costs, and use technology and innovation to help us in our healthcare quest.
And again, this is that disharmony between what they said and what they're feeling. And good innovation in our organization and many organizations, again, starts with the human experience.
So I do attend a lot of events, and this is by far, from a value perspective and productivity, very good, because you're engaged with the right senior leadership where I focus my time at. So overall, it's been a very positive experience.
The way that I would compare this to other shows would be just the intimacy of this show. You don't have the same amount of people, which I think is a really good thing because it does give you the opportunity to actually start making connections with people that are attending.
Yeah, I found the social events very informative too, and we can talk in more of a social setting and really get into some in-depth discussions that you couldn't get into during the lectures.
Your brand is not about the service that you provide. The brand is about the impression that you leave with that human being. The brand is about how that patient feels at the end of the day after being with you.